This is your friendly neighborhood PhD, and you're listening to the Tide Pod. Hi, everybody. It's another edition of the Tide Pod, and today I'm excited to talk to Anastasia Hall, who is are you a medical student, or what exactly is the department that you're in?
Yeah, good question. So I go to Johns Hopkins. That's where I'm studying right now. I graduated in pre-med. Right now I'm doing my master's of public health biology. So very biomedically based, like understanding how different diseases occur and understanding what treatments work and why.
That's such a big thing. I think links so many areas, and synchronizes, I think, expertise from so many fields. So I'm definitely, excited to learn a little bit more. And I really appreciate your approach with your social media, trying to get some scientific facts and information out there to the masses, that's a little more digestible. So that's
Yeah,
really great.
yeah, we'll talk more about like both of our kind of science interests and both of our communication work later, but I think it's so
Yeah.
important to me, like, and we'll talk about this soon, but my main goal is like I want patients with complex chronic illnesses, all the different comorbidities to understand basic foundational science concepts so that
Mhm.
when they go into the doctor's office, they can feel more empowered to advocate for their needs, right? And know what's going on
Right.
inside their bodies.
Right. And self-advocacy is something I think most people, can benefit from having some more information and insight going into an appointment. So that's really, I think that's such a good, goal to have basically.
Yeah,
But
thank
yeah,
you.
kind of a just an early like icebreaker question before we get into details. So like creative
Yeah.
areas that are kind of an escape or somewhere you kind of go to relax or do something just because you enjoy it. What specifically? Is there one
Yeah.
thing that comes to mind right now?
Yes, it's kind of a newer hobby and it's a skill that I'm still working on, but I think that's kind of the fun part of it. And it's hand molded pottery.
Hmm.
When you see my pottery, it's very like imperfect and a bit misshapen. And like doing that as a hobby, it's kind of a goal in and of itself because I'm trying to do something that like it doesn't have to be perfect. It can just be like for my enjoyment. So pottery is something that's really fun to me right now.
That's really cool. I don't know if you can tell in the background, I have some hand molded pieces. I worked with an
Oh,
undergraduate student who made those for me, and she kind of had that skill of that creative side, but also was getting into, research and academia too. So
yeah.
it's very, very cool. I really appreciate that kind of, creative
Yeah.
work for sure.
Well, the pieces I see behind you, they look really like perfect. I would never know that they're
They
hand bolted, to be honest.
they were like fired, and one of them is like Rio Grande clay, I think, from
Oh,
that river too. So it's really cool. And I back when I was able to physically, I did quite a bit of sculpting and modeling clay and that kind of thing too. So that's I really
wow.
appreciate that kind of
Yeah,
artistry.
it's really interesting, like because we've had a few conversations here and there about like how our science work is of interest to us, and then our creative side also
Yeah,
comes through in both of our work as well. So that's something that I haven't really seen so much from someone in the
yeah,
field. So it's like exciting to have those conversations for sure.
yeah. Like you can have both of those parts of you, right? And like that kind of goes into what I like in these conversations is showing like our overall like human, just connection, whether it's chronic illness, disability, like whatever,
Yeah,
that side of us looks like there's other areas,
yeah,
that make us unique, I think, and the fact that you have that creative side versus, the scientific research side, I think that really
yeah,
brings some nice balance. It's maybe needed more, but yeah,
yeah,
I really that's a really cool hobby though to have to get to channel some energy into.
yeah.
Um,
Thank you.
yeah, but if so, I'd like to get into a little bit more about your story and like background in chronic illness disability, just some highlights maybe you've experienced, and we can get, dig into more details on that too.
Yeah, yeah, my experience, it was like so many other people's. I caught COVID in April of 2022 for the first time.
Hmm.
It was about 6 months later when I woke up one day, so at the end of 2022, and I just felt really, really sick.
Hmm.
And I felt really weak. Like I couldn't really hold my body up, basically. And at that point, I knew something was really wrong. I had been in good health like pretty much my entire life. And soon after that, I was diagnosed with POTS. I had pretty severe POTS, obviously post-COVID. And also came to find out that all along I had Lyme disease untreated, along with some other suspected tick-borne illnesses,
And
birth
so
canal
that was going
alopecia.
on years before the POTS diagnosis and everything. Okay.
Yeah. I was going on years before, but I never knew I was bitten by a tick. I never knew that I had these conditions
Hmm.
until post-COVID. And that's something that a lot of people go through where they get a COVID infection and they actually do think there is quite a bit of evidence that catching COVID can reactivate some old infections. Bartonella is one, for example. Lyme is also suspected, Epstein-Barr virus. So a lot of these things can become reactivated after COVID. And they can become reactivated like under periods of stress even.
Mhm.
So imagine like, okay, they can start back up when you're just a bit stressed out. Like imagine what a COVID infection can do to
Right.
these infections, right? So um, that was a really interesting time trying to get those diagnosed. Um,
Right. Right.
as I'm so sure it's the same for a lot of people. But I think the most challenging part of that was becoming disabled. And then I had a really tough time getting accommodations from my school
Mhm.
at the time.
Okay.
Yeah.
Yeah. Yeah. I definitely be curious to get into that and what the accommodations look like and what you had to go through to get it.
Yeah.
So like you were already going to university at that point at Johns Hopkins when that everything happened with COVID and
So I'm from Toronto. Like at that time, I was studying at my undergrad at University of Toronto. So it was
okay.
maybe an hour away from home. I lived in the Greater Toronto area. And basically I got sick over the Christmas break.
Mhm.
So it was really interesting because I changed a bunch of my courses to be online
Mhm.
for the next
Right.
semester while I was figuring things out. So I was very lucky that I was able to do that. But tried to go back to school after that, after
Mhm.
about 6 months of treatments and trying to recover, pushed myself a lot and then went straight back to crashing. So it was kind of this up and then all the way back down.
Right.
And that was the point where it was really hard for me to even like physically get to classes.
Mhm.
So that was the tough part where I was like, hey, I'm bedbound,
Right.
can I please get some accommodations? Can I do like my exams remotely? I'm doing all of my homework, all my assignments are in, I'm not asking for extensions.
Mhm.
And they're like, we've deemed you medically appropriate to come in person.
So they weren't, it wasn't like, sure, you could just do a hybrid version or something of all your classes and just transition that way. It was, they deemed you fit, quote unquote,
Yeah,
to attend in person. Wow.
yeah.
Did they, I mean, I'm sure you provided doctors like information and notes and all of that kind of thing. What was their response to that when,
Yeah. Yeah, it's funny because like of course, like when someone asks, okay, we need some evidence for this, like I had two of my doctors, so two different specialists who were, independently treating different conditions that I had. They received the letters and even after then, they were like, we've deemed you fit to come in.
yeah,
So I I literally laid on the floor of the exam center.
seriously?
I
Wow.
know. I know.
Why does it
I
have to take that to, I mean, it just should not be a hard thing to get approved.
it was crazy honestly, but I think I had it in my brain that I wanted to finish my degree
Yeah.
because I heard so many stories of people my age that got sick midway through their university experience and
Mhm.
like they left university and they were never well enough to come back. So I
Yeah.
kind of knew like I need this degree,
Yeah.
I was like, I'm getting it one way or another. So of
Right.
course it was disappointing to have that response from my school. Um, I was very, very surprised that
Mhm.
I finished my bachelor's, but very happy. And luckily things are better nowadays in terms of
That's
classes because yeah,
good.
Hopkins is like so much more accommodating with this. They
Yeah.
have different laws actually in the US than Canada, which I learned. So I'm able to like get the supports that I need.
Yeah, well, I mean, that's just like a life-changing thing because, even before COVID, I had professors that worked with me and they ended up becoming some of my advisors and they pushed to get accommodations put in. Like even the graduate office, there was one that they were able to get a push button installed that I could use and, like bathrooms with push buttons, which, obviously if like wheelchair users know, a lot that there's push buttons outside the building. But other than that, once you get in, you're kind of, you know, on your own basically. So I know that when you have those supports you need, it's really empowering, as you're going
Yeah.
through. Do you find it strange how, I don't know how that university your undergraduate was at during COVID
Yeah.
going all to remote learning and everything, but it was almost like everyone made the switch and all of a sudden that was available. And then
Yeah.
it was like, well, let's just get right back to normal, once numbers were I mean, they were down obviously, but still the
Yeah.
impact is not, it's not going away.
Yeah. It's a good question because I remember like I when I was going in person to lectures, I remember it was me and this other girl who was my lab partner, and we were the only one wearing masks in this big lecture hall of like 300 people. And so many people were coughing, like coughing, coughing, coughing. And it kind of makes you think like it makes you a bit angry a little bit that people don't stay home to protect their classmates and their colleagues.
Right.
That's a big issue for sure. But I think it was shocking to me. Again, no, don't want to talk too much about the accommodations thing, but
Right.
I did 60% of my degree online because of COVID. Like I started my degree 2020. I did most of it through online classes.
Mhm.
And then when someone is disabled and needed those supports, it was like, oh, this is not an online degree. I've done 60% of my degree online. I found that very interesting to say the
Right.
least,
I agree.
right?
I
So,
agree. Yeah, that's such a strange thing to think about. How, like all of a sudden, well, it becomes a disability accommodations issue when it was clear that was doable, and so many people did it, like not even
100%.
thinking, and it was fine. So
Yeah.
it's yeah, it's a weird whole procedure with accommodations
Yeah.
and everything. But yeah, I getting into a little bit more of like your experience and like your kind of
Yeah.
current mission with your research and degree
Yeah.
and kind of where you see it going. What is that like for you now?
Yeah. I mean, I started with this dream of going into medicine, getting my MD, and it was like that since I was a teenager. And I'm sure they call us keeners, so
Mhm.
you're or gunners, like you're gunning for med school. um,
Mhm.
so everyone would like joke around and say, "Oh, you're such a keener," or whatever.
Yeah.
So I really wanted to go to med school always since I was a teenager. I really shifted gears since then, since I got sick, to science
Mhm.
and being a scientist. Right now, my training is in infectious diseases, mostly Lyme disease, tick-borne illnesses, malaria, tropical diseases, like things like that. That
No worries.
surprisingly, a lot of ME/CFS patients have a lot of these infections. Either they picked it up when they were traveling, they picked it up through a waterborne exposure. And I
Mhm.
find that relationship really interesting because a lot of people with post-infectious syndromes, they don't usually have just one infection. They a lot of the times have many.
Mhm.
So I care a lot about the infectious diseases side of complex chronic illness.
Mhm.
I care a lot about the downstream comorbidities and conditions that happen as a result. And I think a lot of the post-COVID illnesses, a lot of the ME/CFS, POTS, and so on are happening because of infections. So,
Mhm.
long story short, what I want people to understand, like my whole platform is about patients. I talk a lot about like trending topics, I guess you could say.
Mhm.
There was that paper recently on the complement system and how COVID activates complement mediated antibody, basically killing of healthy cells.
Right.
That was something that I was like, oh, I know a lot about that. That's my
Mhm.
training, right?
Mhm.
So it was exciting that all these patients were like, can somebody please explain this to me? And I was like, it's my time. Like
Mhm.
I came in and
Exactly.
I really like to talk about that paper. And yeah, any kind of paper that people are like, what is going on here? Can someone please like
Yeah.
break this down? So I like to kind of use my skills to do that.
And that's such an interesting thing too. I think about a lot is, when someone just Googles something or looks up something, right? They rarely get the actual scientific journal or information directly from there, or, and a lot of times not, they don't get really any of the actual information from that. So it seems like, and I don't know what your experience is, that
Yeah.
availability to the general public is rare. Like there are
Yeah.
not many places they can go to find that information.
No, it's true. And yeah, it's very true because when you search on AI and there's now like I believe that the associated AI with Google is Copilot, if I'm not mistaken.
I
But
don't
when
know
you
for
Google
sure.
something,
Yeah.
yeah, you Google something and an AI explanation of it comes
Yeah.
up, they'll kind of take snippets from here and there.
Hmm.
It also depends on the way that you ask the question. So if you ask, okay, something like, does the SARS-CoV-2 virus stay in the body for extended periods of time? The answer that you'll get is yes, they can. But the issue is that that's not the case for all long COVID patients. So it's kind of interesting with the AI is like it will say yes as long as you ask your question a certain way, but sometimes if
Right.
you ask the opposing question, it will also say yes. So it's an issue because it doesn't always recognize the nuances.
True.
Whereas I feel like people, scientists
Nuance
like you
is,
and I, yeah,
yeah, yeah, nuance is such a big deal, right? I mean, like it's never a black and white situation, or at least rarely ever. And so when you get generalizations thrown at you like that, and it's like, well, I got my answer. I was like, no, you really don't, you don't know the
yeah,
context or any of
you
that.
got
And
half the answer. Yeah.
right, exactly. Yeah. So I think that's a really, self-diagnosing and everything like that. It's still, I think, a big problem for sure, and then as far as like the medical side, I'm curious your
Mhm.
experience with diagnosis, working with doctors, any
Yeah.
specific challenges that arose there through like your diagnosis and everything, and how you kind of overcame
Yeah.
them. Yeah.
Yeah, there
And
were
obviously
issues
like
along the
share,
way.
yeah, just share like whatever, detail you would like to.
Yeah, there are issues along the way, and like it's tough because so many of us take the initiative to educate ourselves, read papers, read articles written by MDs. So I would say that a lot of us within the complex chronic illness community are very well educated on our conditions. And so anyone with that initiative, like such as myself, will go in
Mhm.
to the doctor's office or the ER and say, I believe this is what's going on. This matches up with my symptoms. These are my conditions, and here's how they work. And I think sometimes depending on the clinician that you come across, it can be received really well, or it can be received as like the patient saying that they know more than you.
Right.
And that's not what patients are trying to do at all. I think a lot of the time these are rare conditions. Rare, I say in quotes, because a lot of time they can be underdiagnosed as well. But patients are really just trying to meet clinicians halfway. I think that's something that we forget really easily. But going back to my experience there, I remember so 2023, I had been diagnosed with POTS. I'd been diagnosed with ME/CFS. Um, I came to this point where I kind of lost control of my movements one day, and it was really concerning. It had never happened before. And they say that when you have a change in your symptoms, you should pursue care. Like you should tell your primary care physician, or you should go to the ER if it's serious enough. So I went to the ER, and the physician on call said that, I don't think there's anything wrong with your neck, right? And I was like, huh, I have really bad neck pain, have a lot of concerning symptoms lately. And a month later, I was diagnosed with CCI.
Wow. Okay.
Yeah, so another obviously related comorbidity, but
Right.
serious neck issue that can cause compression, sometimes of the brainstem, sometimes of the vasculature around your neck, like your
Mhm.
jugular vein, some arteries, carotid artery. So it can be a big issue for like your mobility,
Mhm.
your cognitive function. It can do so many things, but it was interesting to me, just the variation like in clinicians' responses, as in
Yeah.
like they're so sure that, nothing's wrong. Nothing's wrong for sure.
Yeah.
Meanwhile, I'm a young, healthy 23-year-old where, there shouldn't be these issues happening.
Right.
So yeah.
Right. And I think there is this sense of frequent misdiagnosis, or if a patient comes in asking or, questioning anything, is taken as maybe a challenge to
Yeah.
the authority or whatever, certain physicians
Yeah.
think that they have, and that for you, was there a time when you did find doctors that were willing to be more of a back and forth team and actually try to work together to, to find treatments and ways to minimize symptoms?
Yeah, absolutely.
Mhm.
And I came across those doctors reasonably early, like a lot earlier than the average person with complex chronic illness finds the right physician, just because I'd had family members who went through the same thing and they kind of had recommendations of who to go to, right?
Okay.
Who to be referred to. But the doctors that I have now are amazing. Like it's more like a collaboration
Yeah.
than someone is telling me how things are going to go. For example, like I am able to bring up, this new treatment that I've read a few papers about, they've done some new trials on,
Mhm.
and the doctor would say, "Oh, I've heard about that. I was actually thinking about that for you. Let's try that for POTS." You know what I
Mhm.
mean? And so for POTS, for example, or ME or long COVID, like any of these, like a lot of the treatments are off label. And so up until recent years, there were very few treatments for POTS. There was one really, fludrocortisone, and there was beta blockers
Mhm.
as the secondary like alternative. Um, Up until recently, there weren't many. Okay, if those failed, like if those treatments failed, there weren't many options. But what's really interesting is that I think doctors and patients are collaborating and having these important discussions where doctors feel it is appropriate to prescribe off-label medications more because they're seeing that they're working. And so I feel like it's a two-way street now between the two stakeholders, doctors and patients, and that has just exponentially like led to so many more discoveries of
Mhm.
medications that are helpful. So
And you wonder if that happened more frequently with, any other health conditions over time, if
yeah,
that would lead to better treatments and not so much even a one size fits all approach, right? Like, so I know
yeah,
there's people get diagnosed and there's like, oh, there's this one thing you can try and that's it. And me
yeah,
growing up with muscular dystrophy, it was like,
yeah,
here's the steroids to try to give you muscle strength and progress, like keep that from progressing downward. And other than that, it was like, there's clinical trials, but we're kind of waiting around. There's promise for treatments, but it's not going to happen anytime soon, you know? So
Yeah.
it's like at that point, you're just trying to find someone to work with you to manage, if not
Yeah.
quote unquote cure the, what's going on. And I even think now I had a pulmonologist when I first had the trach and ventilator put on it. And the person said, I've actually never seen a patient that had a tracheostomy and a ventilator at the same time. And I'm like, well, that makes me feel comfortable. So, and then so I went through and looked for some other doctors. And now that I'm in a different state, I found a pulmonologist who actually is willing to say, well, if you want to wean off, we can try this approach, but here's the trade-off
Mm,
if, and that back and
yeah.
forth dialogue and team approach, I think is just, it's like life and death, like night and day difference between,
Yeah.
I think, being able to manage these things. So yeah, definitely when you find that,
Yeah.
it's really amazing.
Yeah. Absolutely.
Yeah.
I think a lot of us, or I don't know, I think our standard of what we've seen in the clinic,
Mhm.
from both sides, clinician and patient, is okay. Patient comes in, I've been having these issues. Doctor gives you, okay, diagnosis may be differential
Yeah.
diagnoses, right? Maybe some follow up lab testing.
Right.
Here is your medication. I think a lot of the time at that point, patients feel kind of awkward to ask questions. And you mentioned this too, like it's an interesting power dynamic sometimes, a lot of the time unintentional. But I was even like having a conversation with some qualitative researchers recently,
Mhm.
in my field of infectious diseases. And they were kind of mentioning when they do these qualitative interviews, they're just asking questions. They're not doing any sort of intervention to try to influence doctors' approach to
True.
practice, right? Literally just the fact that they're asking these questions and making people think. They mentioned that physicians will come back after, the study period and say, "Oh, you completely changed my opinion about how to
Mhm.
approach my patient
Mhm.
interactions." And that
Mhm.
was literally just from asking, thoughtful questions and kind of like planting that seed of like, like maybe I should approach it a different way, when patients ask questions.
Mhm.
So yeah, I just find that really interesting. It's like I think also doctors are so busy
They
that a lot of
are.
the time, like they're so exhausted that
And that's something
they're
that should
yeah,
be considered always,
yeah,
and the limitations. And yeah, I mean, that's that
yeah,
both sides face major
yeah,
stress points and limitations, I think.
yeah.
And so, yeah, you're
And
right.
I
Like that
think that can
openness is
yeah.
big. Yeah.
I
Yeah.
think that can unintentionally hinder the
Sure.
communication sometimes, but when we stop and we think and reflect
Right.
on these interactions, they can get a lot better for, the
Right.
next time, right?
Exactly. And if you think
Yeah.
about it, I mean, like the knowledge that both sides are bringing and experience should be used to come up with the best answers possible. I feel like because obviously the
Yeah.
doctor has all of this, training, going through studying all the diseases and everything, but then the patient has the lived experience. Like this is what
Yeah.
I'm feeling day to day. And so if there's a combination, I think I mean, that's to me the only way to really go about it. But
Yeah. No,
it's
I totally get what you're saying. And like I heard this saying, you could say, you are the expert of your own body, right? Like you live in your
exactly.
body every single day.
Yeah.
So if something changes, like you are the expert, you know best what's going
Right.
on. So yeah.
Right. And whether or not that's even, if it's obvious or it shows up in blood tests or anything like that, at the end of the day, it's still how the patient's
Yeah.
feeling, right? So
Yeah.
that's I think needs to be trusted for sure.
Yeah.
Actually going to that trust, like were there times where you kind of like tried to ignore things your body was telling you or like tried to downplay it and still like get through? Like what were there times with that? And how did you kind of come out of it? Now, like where are you as far
Yeah.
as listening to, what it's telling you?
Yeah. I think I think all of us can give advice to people coming out through all these experiences to the other side, but we've all been at the beginning at some point, and there was a point where I didn't have any diagnoses. I didn't know what was going on. I I was one of those people that would prioritize school and achievements over everything. Like I knew I was
Mhm.
really sick. I knew I was struggling to physically walk to class, but there was just no option in my mind to say, "Hey, let's take a break. Maybe I can pause for a few months and come back later when I'm feeling better," which a lot of patients do, and I think that can be the right choice for your body. But I think it definitely contributed to my deterioration at a certain point, and made me bedbound was when I was very clearly stressed and I just kept pushing myself and pushing myself. And a lot of us with chronic illness obviously are very susceptible to
Mhm.
stress. Stress can swing our symptoms from decent one day to really flaring up and struggling the next day. So, but now I'm happy to say that after banging my head against the wall for a few years and realizing like I'm not going to be able to operate at this pace anymore. It's just not reality. Like I feel like I'm at a happy medium and at a happy balance in my life. So I can say with confidence that I've proved in my, you know, my desire to push myself has calmed down a lot. Yeah.
Definitely. And it's almost like a self-competitive thing, or it was in my experience too, just like you want to push through and keep going and keep progressing. And, you almost use it as a way, for me, as a way to focus on something other than disability too, right? Because like you can fully dig into it, but then at the same time, there's so many stressors and so much anxiety, and you can get burnout, obviously, and then stress, yes, absolutely. Like your body, you know, it does
Yeah.
not like that. And then in kind of the academic world, I think it's always right there, if we let it kind of
Yeah.
take over. But
Yeah.
yeah, that's good to hear though that you found that balance in place where you're still
Thanks.
obviously progressing, with your journey with, getting your degree and doing research and
Yeah.
everything. Yeah.
What I will say is like personally, and like I hope that everyone in this community kind of finds their own version of this.
Hmm.
Just speaking from personal experience, like school and studying and learning, like that is something that gives me so much joy when
Hmm.
it's not like at a very fast pace. So that's something that it just gives me something to look forward to, something to like enjoy and get out of bed for in a way.
Right.
But for a lot of people, that is like their family, that is their books, their hobbies, their
Exactly.
friends. Like,
And,
yeah, there
and
could
and
be a lot
like
of
quality
things.
of life and just enjoyment in that area, I think
Yeah,
it shouldn't be a stressful, anxiety
yeah,
laden thing, right? It should be something to, I mean, like, give you joy and quality of life and kind of a
yeah,
drive to even overcome a lot of the things that we go through, I think too. So
yeah,
it's a fine line. You're right. Like everyone needs their kind of their own balance with what they're doing versus, the health things that they're maybe going through. But yeah, like
yeah.
that whole community and sense of like passion about something is like I don't know. There's no other way to like no other experience like it really. So that's
I know.
yeah, that's good to hear. And like I'm always excited to find someone else that kind of
Thanks.
has that kind of passion
Yeah,
for it. Yeah, yeah. So I guess I definitely know that we have maybe some plans to share some other scientific takes or other information with people later. But
yeah,
I think that these kind of discussions are really helpful. I think, and I hope it's that way for the
yeah.
listeners too. But is there like what would you suggest for people that are just starting to deal with complex health situations and like how to navigate or how to even begin to, I guess, accept it or to move forward with it?
Yeah. It's what I do want to say is that like the advice that I might give to different people
Right.
going through different stages or different experiences, like chronic illness is so highly individual, and even how you respond to with these experiences, these tough experiences, like it's so different. You know what I
Mhm.
mean? And we all kind of have that evolution of like starting off really struggling. This is maybe a new area to somebody to, okay, I'm kind of getting the hang of things. I'm adapting to, I don't know if thriving would be the right word, but
Right. Right.
happy in your life and managing things well. Um, what I would say is to build your support network and
Hmm.
don't be afraid to rely on the people in your life, your family, your friends, like your neighbors,
Hmm.
whoever it is. Don't be afraid to take up space and ask for help. And I think for me, just as an example, not asking for help made me basically made my symptoms get even worse.
Hmm.
And so I think I don't want to be like regretting anything because I personally don't believe in regrets. But I
Right.
think my biggest advice would be if you have a new condition, don't be afraid to lean on people. If you need someone to help you make meals or ask a friend to deliver food, like you should feel comfortable asking
Right.
for those supports. And I'm saying that to myself as I'm saying this to everybody else,
Same
right?
thing. I mean, that's advice to take to heart, I think, for ourselves too. Yeah.
Yeah.
And to me, like even the connections and like forming that support network, it becomes stronger when you do ask, for help. And
Yeah.
I think of several times with myself and family, where we were kind of forced to, but then that actually, led to us developing, really good relationships with other people. And even like for me,
Yeah.
looking to social media too, like there
Yep.
are these amazing networks, that I've found and so many have found. And I think that's, another source of, community and support that you can
Yeah.
right away start going to and at least getting some kind
Absolutely.
of, yeah, some kind of help through. Um, yeah. And
Yeah.
that's like, neither of us are medical doctors, obviously, and we're not,
Yeah.
giving any medical advice, but just kind of the lived experience we've had, I feel like is, something that many of us bring to the table when we're looking to, help
Yeah.
process and get through these things. Yeah.
That's a
Yeah.
great point because I do want to continue off of what you just said because in an area where your conditions are not very well understood
Mhm.
by the average physician, or maybe there's more focus being put on you as the consumer to okay, go out and find your own sources of, management for your conditions. That is the case with a lot of newer conditions like long COVID within the last 5 years. Um, it's funny that a lot of patients are almost like at an expert level of knowledge with what works and what doesn't, what you should spend your time on versus what you shouldn't. There's not a lot of evidence to support in terms of therapies. Strangely, Twitter is a good place to connect. I know Twitter can be really questionable sometimes, but
All platforms have their
surprisingly,
issues, but yeah.
yeah, surprisingly, a lot of patients who know a lot about science and know a lot about different new therapeutics like are on there, and I've learned a lot just from average people, not necessarily with a science background. And I think that's what's so inspiring to me too, is that these people come from other fields. These people are artists, like you know not necessarily like,
I
yeah,
it's
scientists.
fascinating, like so many of them can become more of the experts than most, really. Yeah.
Yeah, I
Yeah.
find that really interesting and like inspiring,
Yeah.
so
Yeah.
I
Actually,
take a lot of
that hits home
mhm,
right away because yesterday I actually had a pulmonology appointment, and we were talking about like different ventilators I could try, like some are
yeah,
smaller or more reliable or whatever. And my doctor said, yeah, I actually have this other patient who's like a big advocate, and she knows more about all the ventilator brands and types than almost
mhm,
anybody I know, even the physician.
yep,
So yeah, you're right. I know exactly kind of what you're saying on
yeah,
that. Yeah, but Twitter, I'm
yeah.
gonna have to dig back into Twitter a little maybe and see what's there.
Yeah,
Brave the minefield of yeah.
oh yeah, I'm glad that I didn't go on Twitter until recently in my chronic illness journey
Yeah,
because, when I was bedbound, it probably wouldn't have been a good space
maybe not.
to
Yeah,
kind of engage with. But just speaking from, okay, new treatments and supportive management
yeah.
therapies, POV. Yeah.
Right, right. Yeah, I mean, it's good to know that there are, good things about, platforms maybe that we didn't think
Yeah.
before. But yeah,
Yeah.
so speaking of Twitter and platforms, like how do people reach out and like kind of see what you're up to and get some information,
Yeah.
that you provide? Because I know that you've, really been putting a lot of,
Mhm.
detail and work into sharing some of this information with everybody. So yeah.
Yeah. Thank you. I'm Science with Anna
Hmm.
on Instagram. Instagram is my main platform right now. Um, I am also on TikTok.
Hmm.
I'm trying to get into the TikTok a little bit.
Speaking of dangerous platforms to get into.
Why? Why do you say that?
Oh, I don't know. It feels like TikTok kind of has that Twitter stigma, at least from my experience of like,
Oh,
all of the
that's interesting.
yeah, I don't know. Maybe it's just things I'd heard before, but yeah, I've been off Twitter now for a few years too. But
Honestly, fair enough.
yeah, what you're saying
Honestly,
makes
fair
me
enough.
want to kind of dive back in and just see, if there's some
Oh,
helpful stuff there. But yeah, yeah,
maybe pull up for like a few minutes, and then if it's
right.
not, you know what I mean? Take
Yeah,
what
oh, I
resonates and
totally
leave what
right,
doesn't.
right, exactly. No,
Yeah.
that's good advice, and I need to remember to apply that too. But yeah, so definitely you know I really appreciate you taking the time, Anastasia, and talking through some things. I look forward to sharing some more knowledge because I think we both
Yeah.
experience things, and kind of having that patient and research side. I think maybe we can hopefully help share some information with
Yeah.
everybody else. So yeah, yeah,
Yeah. I'm really happy to connect and thank you for having me. I think it was great to chat with you today. So
yeah,
thank you.
definitely appreciate it. But